general process. It will be sore. That's the area that people have the most soreness for about 4 to 5 days. Occasionally I've had a few people last even a month in the donor areas. So let's talk about the most important area. It's the eye. I think the oculoplastic surgeons can agree to this, and I think it's the area that really allows you to see the beauty of someone's face. So if we look at this lady, only 39 years old, she had a brow lift and upper eyelid at 32, and this is about 9 years out on the left side. And if you look at her intuitively, you look at that brow and you say, it's too heavy. Go ahead, doc, let's go ahead and cut some more. In fact, she was about on schedule to go and do another brow lift and more skin removal. But look at her face at 28. There is almost no supratarsal crease, and that brow is full. And the brow is not necessarily higher, it's fuller. And so what I did was I made it fuller to make it look less heavy. It's obviously retraining your eye. And if you look, you need to balance the cheek. It's not almost no one has this heavy brow and an empty cheek, but some people have a heavier cheek and empty brow. So it's understanding patterns in nature and trying to reproduce it, and then matching old photographs. You can see that heart-shaped face. I also did a little plasma resurfacing on her skin to help soften some of the laser demarcation from previous CO2. This is a lady 47 years old, and when I see the eyelid skin beginning to hang right at that ciliary margin, that's when I usually take a couple millimeters of skin off. I rarely take fat. Occasionally I take the medial fat pocket if it's really pronounced, and I don't do a brow. This is just filling it, and filling it really, really softly. There's no eye bag removal. This is just filling fat in the lower eyelid, and then this is and plasma resurfacing to help the skin a little bit. Part of the thing is that when I look at a face, I try to, about 10 out of 10 will get fat around the eyes. 1 out of 5 will get a upper eyelid, a little bit of skin removal. And 1 out of 10 will get a transconj bleph with that. So I don't do a lot of transconj blephs. This is filling around the eye, and you can see that actually, do you see that line on that upper eyelid I'm talking about? That's that line that I target. I hit that line and soften it. And then if you see her, actually her supratarsal crease has gone down, it's lowered. But that's, to me, more attractive than raising it, because it's a better frame. So just filling it in subtle areas creates a beautiful, beautiful look, in my opinion. And what you may see is dermatochalasis and brow ptosis, I see as deflation. And this is just filling that brow laterally and medially to create a better look. And this is when I was more focused on the lateral. You can probably see there's a little deficiency in the medial aspect, but not bad. This is a lady, if you look, she's got this almost negative vector looking eye, and really what would you do to cut this and lift it? Anything you do is going to make this eye stand out more, but by softening and framing it, it really creates a better look, and that cheek and jawline is really a nice support to the face. That's also a facelift. This is a lady that if you look at that brow, she's only 41, she's already had a cut on the upper eyelid and brow lift, and I don't think that's an attractive look. It actually looks, she looks older than her age. And so by filling and pushing the brow back down and creating padding, I think I've created a softer look to the face. Let's talk about facial shape. Inverting the triangle, you heard me mention it earlier. This is a lady that if you look at her adding fat, I took a little bit of skin from the upper eyelids and added fat. She's a little undercorrected on the lower eyelid, but if you look at her, she looks slimmer. 46 years old, looks slimmer with fat. Almost ridiculous, right? But this is an aggressive anterior cheek and pre-jowl and chin fill and brow fill to create a slimmer looking face. Here's a 49-year-old lady who's had a brow lift, upper eyelid, facelift, lower eyelid, etc., traditional surgery, still looks quite tired, but what I found to be more attractive in creating her face was the exact opposite, to actually widen her face, to pull that out and create more volume in the right place. And a little bit of, I do use silicone, that's silicone lip enhancement, I don't like fat in the lips, and that's just creating a face that I think, even though it's fuller, is much softer, feminine, rested, and more youthful. And here's a lady who's already had a brow lift and eyelid surgery on the left at 56. Is that rested to you? Or is it just volume depleted? And this is just adding volume in all the right places to create a beautiful, soft look that's gorgeously feminine and rested. And here's a 55-year-old lady. I did a little silicone lip enhancement and then volume. And if you look at her eyes, you can see it's really what you may see is ptotic. I see as deflation. So it's just a different idea of perception. You must understand, in order to sell fat, quote unquote, to someone, you've got to believe it yourself. You've got to understand it, and you've got to be able to show it. And if you don't understand it, you won't be able to communicate that. Using old photographs and matching patients out. This is a lady on the left who's already had a large coronal brow lift and some eyelid work that, in my opinion, she still looks tired. This is a little mini facelift and adding fat in the right places, and she looks like her photo at 40. And it's just getting a face closer to a youthful ideal. That is their own ideal. Here is a 49-year-old lady who's had a lot of dermatoheliosis. Is that right? I learned a new word. And also some acne scars. This is what's amazing. She is on Accutane, Would you touch this patient? Am I crazy? But this whole thing is incisionless. And so this is showing you that over time there's even a softness that to the face without making a cut. I would not do a facelift on a person or a skin peeling on a person that had Accutane. But what's amazing is look at the face in her early to mid-20s. There's that triangularity that's there, and I reproduced it in the photo on the right. This is a frontal view. There's a lady, 59 years old, bad chin implant I removed, and then adding volume, a little silicone lip enhancement. And if you take a look, I did take a little skin from the upper eyelids and a little chemical peel when I was still doing that. But if you look at the shape of the face, there's a better frame, and it looks closer to her face at 35. If you look at that upper eyelid in that small photograph, it's very full and low. So part of the idea to believe it is if you don't believe it, I want you to go back and look at your old photos. First, convince yourself before you convince someone else of this. And then restoring identity, understanding not to make someone look different. That's why the old photographs are so important. People are very frightened to walk out of the door and look like a different human being. Here's a lady that had a brow lift, upper eyelid, lower eyelid, cheek implants. And part of the reason I'm not a big fan of cheek implants for aging face is that it exacerbates transitions. We talked a large part of this of softening transitions. But if you're starting to get bony in the mid-face, I love chin implants, and I don't think there's a substitute. If you have microgenia to get predictable structural support to the lower face, I think a chin implant's critical. You can't do it with fat, otherwise you look like a fat chin. But I will use more chin implants. I rarely use mid-face augmentation with implants because it exacerbates infraorbital hollow and buccal hollow. And that's, in my opinion, a problem. So balancing and blending and softening transition. This is also removing the implants. And this is, as you see, the lines are not improved. Everyone says, oh, the lines should be improved, not with fat significantly. But this is, again, aggressive periorbital eyelid work that has led to, I think, worsening at a 55-year-old lady. And adding volume adds, you know, if you look at that skin texture too, this is a year out, and you can really see these photographs show that there's almost better texture. And maybe that's stem cell, maybe it's not. You probably heard that bandied about. The other thing is, remember, there's just more light on the face. When you create volume, we live in a world with just overhead lights, right? We don't have flash. When I photograph my patients, it's uniform overhead lights, not the single light coming down, but uniform overhead lights in a controlled, non-ambient room setting. And that's what brings out that luster. When you see them walk through the door, you go, wow, from 20 feet away. It's volume. And improving results. Does fat go away? Everyone says it's going to disappear. It actually begins to sing about a year out. There's a lady, let's walk through this. This is 6 weeks out from a full face fat grafting, facelift, and she looks very, very soft, but you can see the edema. And then this is about 6 months out. And what's amazing with the photo on the right is she's had no sleep, less than 1 hour sleep, but she still looks more rested. That's what's so powerful of volume. And this is now 14 months out, single treatment of fat, and you can see that there's this, I can't, you know, what is the difference? It just looks better. I can't put my finger on. That's her photo at 35, where I think the cheeks are too big. I've actually not brought them that big because aesthetically you want to create a face that I think looks good. And actually, let me go back to that one point. Do you see when you go back and look at that upper eyelid, it looks heavy to you and low. I've made it so low that it's hanging over the eye. It looks like that Christy Brinkley photo. So it's a challenge your aesthetic vision today. Non-surgical alternatives, I totally agree with the trend that Dr. Lam was presenting today. It's volume, volume, volume. I rarely feel folds unless I feel it's encroaching on their aesthetic look. Here's a lady that came to me 2 weeks before her daughter's wedding and said, make me look great. Well, this is Juven around the eyes. I prefer now Restylane, but this is Juven around the eyes, a little bit of Restylane in the cheek. This was done last November, so before Perlane and all that. And I don't use Radius a lot only because I like to be able to transition my patient over to fat. This gives them an incredible preview of what fat can look like. This is 4 syringes. My standard is 4 for everyone. And this is a lady, 37 years old. On the left, that's the after. On the left, after injecting a syringe of Restylane into the nasolabial folds and then a syringe of Restylane into the lips. I don't like the lip design and I don't think she looks that refreshed. I came to her and said, let's do volume. That's 4 syringes, 1 cc Restylane per side, a half a cc of Perlane per cheek, and a half a cc of Perlane per lower chin jawline pre-jowl complex. And even at 37, you can see that I've truly rejuvenated her, made her look fresher, feminine, and more youthful. Here's a 49-year-old. This was for a little local TV show. And this is, again, the standard, 1 Restylane per side, a half of Perlane per cheek. And where I target, remember, here's a couple things that are interesting. Do you see how, this is the illusion. Do you look at her upper eyelid? It looks heavy to you, right? It looks heavy because it's not balanced with the mid-face. So oftentimes, when I try to do fillers, I want to create a maximal result at minimal cost. And so I target critical zones, I call them, which are lower eyelid, anterior cheek,